Understanding and normalising the emotional impact of a sudden cardiac event. Hello and welcome to this video guide on understanding and normalising the emotional impact of a sudden cardiac event. My name is Sharon and I'm the lead physiotherapist in the UHBW cardiac rehabilitation team. In this video, we will explore some of the feelings that you may be experiencing and how they may change throughout your recovery. The information presented will include data from research, experiences from other cardiac patients, and ways that you can look after yourself. Overview. This video will cover the following topics: common emotions, stress, processing the event, anxiety, low mood, and tips to help your emotional recovery. If you have any concerns about your heart condition, please speak to your GP, cardiac team, and look at the information on the British Heart Foundation and our trust websites. Emotions. The emotions and feelings that people experience following a cardiac event vary and are specific to each individual. Some are more common than others and may resonate with your experience, and others may not apply to you. Please keep in mind that regardless of what you are feeling, there is always support available from your cardiac team, your GP, and other support services. You may notice that you're feeling lots of different emotions after your heart event, such as sadness, anxiety, and anger. Adapting to an altered lifestyle after cardiac events can be challenging, and you may be feeling particularly emotional or vulnerable throughout this time. As with any big lifestyle change, these emotions will be strongest at the start of your recovery and should gradually improve over time. The next few slides will cover some of the most common psychological challenges in more detail. Stress. Many patients report feeling distressed and burdened following a sudden cardiac event. You may have found several aspects of the process to be stressful. This may have included experiencing the event yourself, your journey through primary care, and adapting to life at home again. Stress can have emotional, physical, and behavioural effects as shown in the table on the screen. When adding these to the pre-existing challenges of physical recovery and lifestyle change, things may soon feel overwhelming and burdensome. It is normal to feel overwhelmed and stressed after a cardiac event and time in hospital. Stress can have a range of effects on how we feel, our bodies, and the activities we feel able to do. Processing the event. Processing such a difficult event can be challenging and even come with intense feelings. However, everyone's experiences are different. You may experience intense emotions and feelings which fade over the course of your recovery. On the other hand, you may feel fine at first but struggle later on. It is important to remember that your physical and emotional journey is personal to you, and it is normal to experience negative feelings whilst recovering. You may notice you experience nightmares, flashbacks to the events, and other difficulties which can make sleeping and relaxing more of a challenge. They may be sudden and hard to control and can leave you feeling panicked, helpless, or sad. These difficulties may also be triggered by certain sounds, smells, or images, particularly those related to your cardiac event. These experiences can be part of how our brain processes and works through the difficult experience, and this is normal. However, if you notice that these continue for a long time, you may want to speak to your healthcare professional to get some support. Anxiety. After a sudden cardiac event, you may become more aware of your physical sensations and overall health. You may feel vulnerable, insecure, and be anxious about another event occurring. This feeling is known as cardiac anxiety and can lead to excessive monitoring of bodily sensations. You may feel overly aware of things like your breathing, heart rate, and chest sensations, and you may feel the need to constantly measure these. Whilst it is important to pay attention to your body, constant anxiety around your health may interfere with your day-to-day life and emotional well-being. These feelings are common. Given how traumatic cardiac events can be, it is normal for you to be worried about having to experience such an ordeal again. There are things that you can do to help alleviate these feelings, and it is important to seek support from your GP if they do not improve after a few weeks. Low mood. Approximately 40% of cardiac patients feel low in mood following a cardiac event, with patients being particularly at risk during hospital stays. You may notice common symptoms such as fatigue, loss of motivation, low mood, irritability, or feelings of helplessness. Your mood may change considerably on a day-to-day basis, particularly in relation to how you feel about your physical recovery and lifestyle changes. As with the other common emotional challenges, it is common to feel low in mood after a cardiac event, and these feelings should begin to subside after a few weeks. However, it is crucial to reach out to your GP and loved ones if you begin to have thoughts around self-harm or suicide. You should also seek help if your symptoms interfere with your overall health, including sleeping, eating, and self-care. As well as being one of the most common mental health problems, depression is also one of the most treatable, so always reach out for help when you feel like you need it. We will now hear what some of our other patients had to say about their experiences.
One day I was just walking and that pain came on and it went down my left arm, and I thought, that's not great. I had severe artery blockages that were going to require a triple heart bypass, which was a massive shock. You go into kind of this shock mode of, I'm going to have an operation and it's going to be a major operation. How am I going to survive this? What am I going to be like after the operation? How am I going to feel having had that type of surgery to my chest and my heart? That was the biggest anxiety for me, that I felt like I could be a completely different person, that I might not even survive that type of operation, even though I'm fit and healthy. You have all these things going on in your mind that, you always think possibly the worst could happen, and that then plays a part of causing anxiety in your brain because you can't stop thinking about it. So the best thing you can do is to talk to other people that can either help you or just talk to people anyway, because one of the best things to do is to get it out rather than let it stay in, because then you start panicking.
First of all, wasn't a lot of emotions, sort of in a bit of a trance, really. It all happened so quickly, and then you end up going into hospital and there's nurses and everything everywhere, and you don't really know what's going on, and you don't take anything in at that time. Afterwards, I was a little bit apprehensive, didn't know, you're thinking, is anything going to happen again? And so you tend not to do as much, as you don't know what you can do. So it's a little bit scary for the first couple of months. Majority of people are older and less sort of active than I was to start with. So the sort of comparisons weren't there for that. And then coming here, when they offered me the place on the heart rehab, speaking to the nurses here and the other people who've been through things a few months before mine, that really helped, because it just gave me a more clear picture of what was going to happen going forward.
When I came into hospital, I was kind of a bit in denial of what was happening and what might happen, whether, it'd just be something simple like a stent. When it came to the triple bypass, I'd kind of got to the stage there that I just wanted to get through that process. And then when I left, I kind of looked at the idea that 3 months would kind of see me back to a reasonable standard of fitness. Looking back on it now, after 7 months, I kind of realised that there's recovering from the physical side of the procedure, but there's also a kind of mental side to it, in that I now think of myself maybe as a little bit older than I did before I had the heart attack. And I kind of see that people around me maybe treat me a little more gently, because, they're a little bit worried about whether I'm still the same person I was before in terms of the things that I can do. So I'm now 7 months post the operation, and I feel like I've almost completely recovered now. My fitness is back where it was before, probably better than it was before. But one thing that really gets my goat at the moment is every morning on the kitchen table, I'm confronted by that tray full of pills that I need to take. And I find that a constant reminder of what I've been through, and kind of stops me from being able to completely let go of what's happened.
There are a number of simple things that you can try to help you cope with your emotions following a cardiac event. Your activity levels will be reduced during your physical recovery, but it's important to try and get up and get dressed every day. Although it may be difficult to find the motivation, you should avoid staying in bed as this can worsen feelings of low mood and anxiety. As well as allowing your body to recover, engaging with your cardiac rehab program is a great way to add structure and purpose to your day. Within the first weeks, you should begin to notice improvements in your fitness, which will encourage you that you're on the right track to feeling yourself again. Investing time into your favourite hobbies and social activities is also an effective way to spend your recovery time and can alleviate some of your negative emotions. If your hobbies involve physical activity, please check whether these are appropriate with your cardiac rehab team. Sleep is crucial to both your physical and emotional recovery, so it is important that you prioritise this following your return from hospital. You should aim for 7 to 9 hours of good quality sleep every night. For guidance on how to improve your sleep, please watch our Sleep and Your Heart video guide. To help you make sense of your feelings, you may find it helpful to write down what's on your mind. Seeing things written out can help you to process what's going on. Lastly, the most important tip on coping with emotional effects is to speak up about how you're feeling, even if you are coping well. Your friends and loved ones are there to help you recover, and sharing your feelings with them will let them best support you. It is also a good idea to join a cardiac support group where you can meet and get support from people who have lived experience of your challenges. A selection of helpful resources and support will also be listed along with this video on our website. Summary. The emotional impact of a sudden cardiac event can be burdensome, and it's important to allow yourself time to recover emotionally and physically. You may feel particularly vulnerable, anxious, fatigued, or depressed following your event, particularly in the initial days and weeks. Being patient with your recovery, engaging with cardiac rehabilitation, and sharing your feelings with loved ones are some of the best things you can do to help alleviate some of your emotional symptoms. If your symptoms are overwhelming or do not begin to improve after a few weeks, it is important that you reach out to your GP for more formal support.